Meet Thomas Boone and Zoe Grace, biological twins of Dennis Quaid. Thomas and Zoe were two of the three patients at Cedars-Sinai Medical Center given a dosage of heparin which was 1,000 times larger than appropriate in the year 2007. According to the National Coordinating Council for Medication Error Reporting and Prevention, as many as 98,000 people die annually from medical errors in hospitals. In 1996, the Joint Commission of Accreditation of Healthcare Organizations established a policy to investigate Sentinel events, defined as unexpected occurrences involving death or serious physical or psychological injury. Since the policy's inception, nearly 7,000 Sentinel events have been reviewed. The top three events were the wrong side of surgery, suicide, and operative and postoperative complications. There are three types of surgical mistakes: wrong patient, wrong procedure, and wrong body part. In 2009, the Rhode Island Hospital in Providence admitted to their fifth wrong site surgery in 2 years. A surgery was conducted on the wrong finger of a patient before staff noticed the mistake and fixed it. Previous surgical site errors involved neuro and oral cases. Product and device events include patient death or disability associated with the use or function of a device in patient care. In 2005, Guidant Corporation recalled 50,000 cardiac defibrillators and pacemakers because of malfunctioning. 21-year-old Joshua Ockrop died while on a bicycling trip when his implanted heart defibrillator short-circuited. Gerald Constantine died on October 8, 2010. After searching for 10 days, his family was finally notified of his death. Constantine had been seeking dialysis treatment at the Alta Bates Summit Medical Center. The hospital records indicated that he had been discharged instead of deceased. Family members looked for him, even filed a missing persons report before they were told the news. Care management events involve patient death or serious disability associated with a medication error such as wrong dose, wrong drug, wrong patient, wrong time, wrong preparation, or wrong route of administration. The Quaid twins were given 2 massive overdoses of heparin in an 8-hour period shortly after their birth. Patient death or serious disability has been associated with the use of restraints or bed rails while being cared for in a healthcare facility. In 2008, in a Chicago nursing home, a patient's neck had become entrapped between the side rail and a mattress. The autopsy confirmed that the patient had died from compressional asphyxia. The coroner's note said the wounds were like that of a strangulation or hanging. The abduction of a patient would be considered a criminal Sentinel event. Newborn Michael Darthward DeWodu went missing from the Lubbock, Texas Covenant Lakeside Hospital when a woman wearing scrubs posing as a medical worker came by and abducted the 3-day-old infant. The mother had indicated that the woman had been by the room several times before requesting to take the baby. In the year 2000, a book entitled To Err as Human was published, intending to be the first in a series of publications regarding the quality of healthcare in America. The book states that the amount of people who die from medical errors is more than those who die from motor vehicle accidents, breast cancer, or AIDS. Also, it states more people die annually from medication errors than from workplace injuries. In recent history, the legislature has gotten involved in healthcare quality through the passage of many acts, including the Medicare Prescription Drug Improvement and Modernization Act, the Deficit Reduction Act, the Tax Relief in Healthcare Act, the Medicare Improvements for Patient and Providers Act, and the Patient Protection and Affordable Care Act. QualityCheck.org is one way that healthcare organizations can now be held accountable. It was established by the Joint Commission and is a way to check for the gold seal of approval and accreditation for healthcare organizations. Their mission, stated all over the website, is helping healthcare organizations help patients. As of 2007, nearly half of the state's legislatures had created regulations for hospitals to report Sentinel events to the state governments. The goal of the state's reporting systems were to both hold healthcare organizations accountable for mistakes and to learn about mistake prevention by disseminating information about best practices across the industry. Thibodaux Regional Medical Center in Louisiana is a 149-bed inpatient and outpatient facility, which continues to be ranked in the top 1% in patient satisfaction. The hospital started by using satisfaction surveys, report cards, and interviews to better understand its customers. It has completed several Six Sigma projects resulting in patient satisfaction, cost savings, and quality improvement initiatives. Healthcare organizations can learn from their mistakes by implementing a problem-solving process. The first step of the process is to identify the problem. Next, analyze the problem, generalize potential solutions, select and plan a solution, implement the solution, and finally to evaluate the solution. The consulting company Stutter Group aids organizations in targeting areas of service, quality, employee improvement, finance, and growth. The group's founder, Quint Stutter, was once an administrator himself and understands obstacles faced by organizations. In healthcare, he focuses on making service purposeful and worthwhile, remembering that the patient is the customer. The Joint Commission's policy on Sentinel events aims to support positive experiences in every patient's care, help organizations learn from their own mistakes and implement preventative measures against recurrences, help all healthcare organizations learn from mistakes made elsewhere, and to validate quality healthcare with accreditation and Gold Seal approval awards. If a Sentinel event occurs, the organization is compelled to conduct detailed root cause analysis, develop an action plan, and monitor the plan in order to determine if the improvements are appropriate. Healthcare organizations may choose whether or not to notify the Joint Commission themselves. There are advantages and protections available to organizations who report Sentinel events as well as penalties for those who do not. DMAIC stands for Define, Measure, Analyze, Improve, and Control. The DMAIC model is one of the ways hospitals are exploring the use of Lean Six Sigma tools to improve their healthcare systems. Healthcare organizations usually measure their performance using metrics such as service level, service cost, clinical excellence, and patient satisfaction. Healthcare organizations can use many Six Sigma tools for statistical analysis of their performance measures to ensure sustainable quality healthcare. Some useful tools include regression analysis, Pareto charts, Ishikawa diagrams, and chi-square tests. Because of his twins' personal history with medical mistakes, Dennis Quaid has become passionate about healthcare quality in America. But what is this quality healthcare we should be striving for? The Agency for Healthcare Research and Quality has coined the following definition for quality healthcare: doing the right thing at the right time for the right person, having the best possible result.